Hi, I'm Dr. Amy Cook with Nebraska Equine Veterinary Clinic. Today I'm going to visit with you about two conditions we commonly see in horses, Equine Metabolic Syndrome and Pituitary Pars Intermedia Dysfunction, or Cushing's disease. I feel like there's a lot of confusion in owners between these two conditions, which are two separate conditions, but that sometimes have some overlap in certain individuals. Equine Metabolic Syndrome is a metabolic disorder we find in horses. It has a lot of similarities to adult onset or type 2 diabetes in humans. Just as people age, gain some weight, become less active, they can develop diabetes. Horses, as they age, gain weight, become less active, and have a diet that is very rich in calories, can develop insulin dysregulation. The issue with this is insulin dysregulation can actually cause laminitis in horses. So we try and catch these individuals before they develop insulin dysregulation or have a bout of laminitis. Usually our equine metabolic syndrome horses are middle-aged, somewhere 7 to 15, often when they're identified. Hopefully we catch these horses before they have a bout of laminitis. So sometimes when your vet is there and wants to discuss your horse's weight or the way their fat is distributed across their body, that is us screening this horse and looking at it for having the potential for equine metabolic syndrome. By identifying these factors, sometimes we can catch these individuals before they actually develop laminitis. That said, in any horse that has a laminitic bout, we will be evaluating body type to try and see if we think that is actually the causative factor. Equine metabolic syndrome is actually a condition that with some dietary changes, increase in exercise, medications if needed, can be treated. So if we can catch this early, oftentimes we can prevent a severe laminitic event and keep your horse happy and healthier for a longer time. If we do suspect your horse has equine metabolic syndrome, we may suggest certain testing to check insulin, glucose, and leptin levels to give us a better idea of how well that horse is regulating their insulin and give us something to measure treatment as we go in response to treatment. We may also suggest things like Thyral-L, which is a thyroid supplement that increases insulin sensitivity, as well as there are some additional drugs like metformin that also can help improve insulin sensitivity. Oftentimes, treatment involves changing a horse's diet and better understanding how we feed them, what feedstuffs are actually safe for those horses, and trying to increase exercise. Pituitary Pars Intermedia Dysfunction, or Cushing's disease in horses, is actually an endocrine disorder. It involves changes in the pituitary gland of the horse that causes an increase in the cortisol secretion. It usually affects our older horses, so horses in their late teens through their 20s and 30s. Symptoms of Cushing's oftentimes include a hair coat that doesn't shed properly, increased thirst and urination, horses that continue to have chronic infections that don't respond to treatment. When we see these kinds of symptoms, very often we will suggest screening that horse for Cushing's disease. Additionally, laminitic episodes will give us a concern to check a horse's Cushing's status as well. Why is it important to catch Cushing's disease? Well, it is important because Cushing's disease itself, an increase in circulating steroid or cortisol, can also cause insulin dysregulation. And insulin dysregulation, as we discussed before, can cause laminitis. So horses with Cushing's disease are at an increased risk to develop laminitis. Cushing's disease can be controlled through treatment with a drug called Presend or Pergolide. Utilizing this drug, we can improve horses' quality of life, improve their shedding, and hopefully prevent laminitic bouts. Now, when we started today, I talked about EMS, Equine Metabolic Syndrome, and Cushing's disease and how they're separate diseases, but there's also some overlap. And so as you can see, we talked about how Cushing's horses can also develop insulin dysregulation, just like metabolic horses can. We can also have horses that are actually metabolic and Cushionoid. These horses are probably the horses that are at the highest risk to develop laminitis and not just have a mild laminitic bout, but a severe laminitic bout. So understanding that can hopefully help you understand how important it is to try and identify these horses earlier, institute treatment, dietary changes to try and prevent a severe laminitic event. Hopefully through our discussion today, you have a little better understanding of equine metabolic syndrome and Cushing's disease and how the two are separate conditions, but also there's some overlap between the two.